In this short presentation, I just want to expose you to what this is because this is often missed in the medical community and could be a huge factor that holds you back in your recovery. It's one of the conditions that I believe people, if not made aware of, can damage their bodies, and that damage is irreparable. So when you hear me talk about exercise and what exercises are safe or not safe, I don't typically use that language. But with this condition, I do. This is the one that I will say you are absolutely harming yourself by not listening to your healthcare provider's recommendations, and often that's me in that case. So let's get started. By the end of this presentation, I would like you just to be aware of the common symptoms and signs of REDS and what you can do to advocate for yourself should you think you have it. So what is it? It's impaired physiological function, including but not limited to metabolic rate, menstrual function, bone health, immunity, protein synthesis, cardiovascular health, caused by relative energy deficiency. So what does energy deficiency mean? Basically, what you're taking in your food is not enough to what you burn. What you burn just to sustain your regular physiological processes, what you burn in your daily life, moving about your day, taking care of your kids, and then what you burn through intentional exercise, or if you are an athlete and playing sports. It's funny, like there's this whole condition about energy availability and the deficiency of it, but there's no way to assess energy availability in athletes or in active individuals. So people that are in this world of treating active populations, they typically have to come up with their own process of measuring availability. And hopefully whoever is doing that is in dietetics of some sort, because these nutritionists that are telling you to count macros, that doesn't count. So what's the problem with this? Well, theoretically, they believe that this condition can impact your GI function, your immunological function, menstrual function, bone health, endocrine function, aka hormone systems, metabolic function, which is driven by a lot of the things I just mentioned, your hematological function, your blood vessel physiology, also plays a role in bone health as well. Growth and development, this is more in the teens, in the early adult years, and then maintenance phase as you're an adult. Psychological consequences, and then cardiovascular consequences. So what does it look like? What may a person with relative energy deficiency syndrome experience? Decreased muscle strength and endurance, increased risk of injury, or you're experiencing recurrent injuries, often stress fractures or shin splints, aches and pains that just don't seem to go away in the normal window of healing. Decrease response or adaptation to your training. So let's say you're always lifting weights, but you're not able to bump up your weights, or you're not able to run any longer and you think you should. An impairment in judgment, that is a broad term. Decreased coordination, decreased concentration, irritability, depression, decreased glycogen stores. So some of these, what's not mentioned here is sleep disturbances, Decreased concentration, I would say you would see that in the workplace, or if you're a student in your studies, or even in your everyday concentration of your tasks. Coordination, so let's say if you play a ball sport, you're just not on your game there. If you're a gymnast or a performance athlete, performing arts athlete, coordination on the tasks you would perform doing that. If you're a CrossFitter, maybe you're just not getting the timing on your muscle up or other movements seen in CrossFit. Or just basic decreased coordination. What are signs? So symptoms and signs are different. Signs are actual criteria for diagnosis. They're tests, either physical exams or other tests to locate signs or identify signs, where symptoms, it's what the person is experiencing. Main three that characterize relative energy deficiency syndrome are menstrual disturbances, impaired bone health, and then low energy availability. And that, because it's hard to measure, there's no standardized measuring tool at this point, is identified mainly through disordered eating patterns. So taking a really thorough history. These are all spectrums because this disorder is a spectrum. It used to be called the female athlete triad, but now it's called REDS because males have this as well. Menstrual disturbances can be anywhere from irregular periods, dysmenorrhea, irregular and infrequent periods, but more than 5 periods a year, and then oligomenorrhea, which is characterized, I believe, at 5 periods a year, taken from my exercise physiology, women's health physiology course with Mary Jane D'Souza at Penn State. We are. And then bone health is history of stress fractures, commonly foot, shin, hip, spine. That doesn't have to be the case, though. Impaired bone health could be reflected by low bone mineral density. So that would be measured through a bone scan. Gold standard is a DEXA scan, and then there's other ways, but the gold standard would be a DEXA scan. Disordered eating patterns would mean you are purposely cutting calories, or your diet is in such a way that you, like, say you have practice or you're going on a 2-hour hike and you don't bring food on purpose. It could be eating disorders, so anorexia nervosa or bulimia, but that used to be an absolute criteria, but is no longer. Disordered eating patterns is now part of it. What are the biggest problems here? The biggest problems are, one, it's not well known by a lot of individuals in the medical community. It is frightening that this isn't well known. I see it, and the only reason why I really am so acutely aware of this is because of my training in college. My professor was one of the researchers in this field. And she said it. She's like, gynecologists don't know about this, and they will treat this with birth control, which is actually masking the problem and not fixing it. It's a Band-Aid. I'll talk about who is in the front lines of identifying this in a moment. I also got exposed to it in PT school, fortunately, in my women's health unit. So go wash you. Number 2, the focus is in athletes. I know myself, I have a hard time saying that I'm an athlete because I'm not part of organized sports, but I am totally an athlete. I think athletes, we need to recognize, are active individuals that are regularly participating in intentional exercise or fitness classes. Number 3, it's often missed in athletes. So even though this is relative energy deficiency syndrome, the screening criteria is for athletes, it's so often missed there. Professional sports, it's better, it's more often identified. I don't know if you guys remember that thing that came out from Portland's track team with the girl who was basically bullied into these very dangerous behaviors of training and I think eating. And she falls under this. She's a perfect example. Last but not least this is so often missed in active adults, particularly postpartum women. So listen to me, guys, and listen to me closely. This is not a joke. Behaviors that you do that fall under any of the things that I'm going to tell you can cause irreparable damage on your body, in your body. The crap that you get online and social media, you got to let that go. Because this is the one thing that I absolutely will turn anyone away if they don't address this. I am not going to help your hip pain. You have to understand that. And this is something that impacts your life. And this is something that I guarantee you will be missed over and over again. I said it. My biggest concern is this pressure from society to lose the baby weight, to get back to your pre-pregnancy weight, which is crazy. Or this pressure to show the world that you're able to get back to what you were doing before. Nothing irritates me more, not because of anything else than this. Like, people literally, these fitness professionals, talk out of their butt sometimes. And they put these ideas in moms' minds. And these behaviors, these resultant behaviors, are really dangerous.